Oh, sorry about that. Hi, I'm Jake, and I'm going to be talking to you about Usher Syndrome. Usher Syndrome is the most common form of deaf blindness in the world, accounting for over 50% of the cases of deaf blindness worldwide. It affects approximately 4 in 100,000 people. It is slightly more common in Ashkenazi Jews and Acadians from Louisiana. Vision loss in Usher syndrome is caused by a progressive form of retinitis pigmentosa that causes loss of acuity starting at birth in most cases. There are 3 distinct presentations for Usher syndrome. Type 1 is the most common and debilitating form. Deafness is almost always complete, and the vision loss from retinitis pigmentosa is devastating. While they may be born with some vision and hearing acuity, they are usually completely deafblind by the age of 1. Additionally, patients with type 1 have vestibular problems, leading to missed developmental milestones like sitting, standing, and walking in infancy. Type 2 is very similar to type 1, but the symptoms are much less severe. Children tend to retain some hearing acuity, and vestibular system is unaffected. The vision loss associated with retinitis pigmentosa in this type is also much milder, with central visual acuity usually intact to some degree. Type 3 is the least common form of Usher syndrome. It has variable presentation and is much more common in people of Finnish descent. Diagnosis is usually made with a combination of ophthalmology and audiology testing. Fundoscopy will reveal the bone spicule signs of retinitis pigmentosa. If possible, visual fields and ERG testing may also be useful, but difficult since most diagnosis is made prior to 1 year of age in type 1 and 2. A referral to an audiologist for cochlear implants or other management of the patient's deafness should be done immediately upon diagnosis. Giving the parents information about resources such as schools for the blind or low vision services will also be very important. These are the mutated genes which may lead to Usher syndrome. Genetic testing is available from the Carver lab, with pricing for both a low-level screener and more in-depth exome test. Usher syndrome is an autosomal recessive disease. This means that unless both parents are carriers for the disease, there is no risk of passing it on to a child. If a person has had any blood relatives with deaf blindness and wishes to have children, they should definitely seek genetic testing to be sure they are not carriers for the disease. If both parents are carriers for the disease, there is a 1 in 4 chance of having offspring affected by Usher syndrome. If a person has Usher syndrome and the carrier status of their partner is unknown, there is a 1 in 500 chance of offspring having the disease. Thank you very much.